Connections Prime is a new program for seniors with both Medicare and Medicaid in South Carolina. That's great. We're going to explain the benefits to both you and your patient. Currently, the situation may look like this for certain participants. They have 3 ID cards: Medicare, Healthy Connections Medicaid, and Part D. That's 3 different sets of benefits. And here's a list of other issues. So these seniors are currently covered by Medicare, Medicare Part D, and Healthy Connections Medicaid. Healthy Connections Prime is a new coverage option that combines all 3 programs into a single set of benefits. Yes, and you'll benefit as the provider too. As a provider, you'll experience a more hands-on approach through the use of care teams, more efficient claims submission, and resources to support your patient's non-medical needs. We'd be glad to. For seniors 65 and over, Healthy Connections Prime means receiving all of their previous benefits, plus extra services, such as a personal care coordinator and a care team. Also, $0 copays for drugs, doctor visits, and hospital stays. And there's just 1 member card and 1 number to call with questions. Participating Medicare-Medicaid plans, or MMPs, even offer benefits like extra vision services, and in many instances, long-term services and supports such as home-delivered meals, temporary relief for caregivers, personal care attendants, and minor home repairs or modifications. Healthy Connections Prime addresses members' psychosocial needs through community referrals and home and community-based services. A coordinated effort reduces avoidable emergency department visits and hospital readmissions. Healthy Connections Prime continues the emphasis on delaying the need for nursing facility care by increasing access to home and community-based services. We agree. Without coordination, sometimes the right hand doesn't know what the left hand is doing, and patient care suffers. It benefits the patient, and it's also easier for you to manage. Healthy Connections Prime also means streamlined documentation requirements and administrative processes, like simplified eligibility checks. There's only 1 card, so you'll verify eligibility and coverage through 1 process. There's just 1 point of contact, regardless of service type, whether it's Medicare, Healthy Connections Medicaid, or Part D. And there's only 1 party to bill. There is no sequential billing. In other words, there's no filing first to Medicare and next to Healthy Connections Medicaid as a separate step. You'll just submit the claim to 1 entity, and your payment will come from 1 entity. Here's how that works. Healthy Connections Prime provides continuity of care. New members will have a 6-month continuity of care period, during which plans must ensure that care continues uninterrupted. This includes ongoing procedures or appointments, as well as current service authorization levels for all direct care waiver services, unless a significant change has occurred and is documented during the long-term care assessment or reassessment. And that ongoing care includes, but isn't limited to, personal care, waiver nursing, adult day health, and home-delivered meals. During the transition period, the plans of your affected patients will help you join their network if you are not currently a network provider, or offer a single case agreement to continue the care. Medicare-Medicaid plans, or MMPs, will provide payments to out-of-network providers at the current Medicare and Medicaid fee-for-service rates for authorized services, regardless of the setting and type of care. We help them enroll in Healthy Connections Prime. Here's how. Passive enrollment, or auto-assignment, to a Medicare-Medicaid plan has started for eligible people who have not previously actively enrolled. The earliest effective date for passive enrollment is April 1st, 2016. Beneficiaries will receive a letter 60 days before their enrollment is effective to let them know about their auto-assignment and which Medicare-Medicaid plan they have been assigned to. A similar notification will be mailed about 30 days before enrollment is effective. Providers should have received a Medicaid alert about passive enrollment at the end of January 2016. A similar alert was sent out by CMS in early February. Let's talk about the Medicare-Medicaid plans now. In Healthy Connections Prime, the Medicare-Medicaid plans, or MMPs, are being offered by CICOs, which stands for Coordinated and Integrated Care Organizations. CICOs receive their oversight from the Centers for Medicare and Medicaid Services and the South Carolina Department of Health and Human Services. The MMPs will ensure members have access to medical and support services. As mentioned earlier, providers have 6 months in which the plans will continue coverage for an existing patient with out-of-network providers. In some instances, MMPs may elect to extend this 6-month period for members. During this period, MMPs must ensure that care continues uninterrupted. Even if the provider doesn't join, they can be offered a single case agreement to serve that particular member. Yes, patient care continues uninterrupted while the MMPs bring you into the network. Are you looking to join a Medicare-Medicaid plan? Contact one or more of the CICOs to learn more about how you can become a Healthy Connections Prime network provider. Still have questions? You can visit our website, www.scdhhs.gov/prime, where you can access our FAQs and provider toolkit. You can also email primeproviders@scdhhs.gov for help with specific questions or concerns. Let's summarize. It's a new program that combines the benefits of Medicare and Healthy Connections Medicaid to simplify the experience for both you and your patients. One ID card, one health plan, and one number to call to simplify your patient's experience. Experience integrated processes that simplify your office's eligibility checking, claims submission, and payments. Experience a more hands-on, multidisciplinary approach to coordinate your patient's care. For you, for your patients, it's Healthy Connections Prime time.